I think a lot of women end up having their ovaries removed because there's a fear of cancer, but actually the risk of ovarian cancer in average risk women is extremely low. It's 1.4% in the general population. I think a lot of women don't understand is that there are significant adverse health consequences related to taking your ovaries out too early. We're not meant to go through menopause before the age of 40 or before the age of 45. There are things that are bad that happen, including an increased risk of heart disease and dementia and Parkinsonism and osteoporosis and even early death. It's important for healthcare providers to understand that women who come in reporting chronic pain, probably of any type, but certainly of the pelvic type, to understand that we need to maybe step back and sometimes ask about adverse childhood experiences and adverse adult experiences, because there may be other things that are going on in this woman's life that may be contributing to this pain. I think it's important for women to know that if they are having chronic pelvic pain, that there may be other answers aside from something wrong with the ovaries or the uterus. And if people have looked and no solution has been found, abuse is incredibly common, and we need to think about that possible association, because there are certainly things that we can do to help address the pain. It may just not be a surgical solution. Women might always not be willing to disclose immediately if something has been contributing, or they might not even really associate a history of abuse with what's going on now, but I think we just need to stop and ask that question. Not all women who have been abused are going to have a physical pain, and certainly anybody having a physical pain needs to be evaluated for that pain. But not all physical pains are going to relate to a problem with an organ inside the body. And sometimes those pains really may be the result of psychological trauma related to adverse childhood experiences, physical abuse, emotional abuse, sexual abuse.